The Oregon Health Authority is announcing 2 more COVID-19 deaths today. That brings the state's total to 3 deaths. In the latest, a 71-year-old man in Washington County died at Providence St. Vincent Medical Center.
At this point, there are 75 cases of the coronavirus in Oregon. We also learned today Clark County now has a confirmed 3rd death. Washington has nearly 1,200 cases and 66 deaths.
Medical experts from Oregon released some projections tonight on what they believe could happen with COVID-19 cases here in Oregon.
But these are projections, we have to point out, that were made before some of the isolating steps that have been taken by the governor. But here's what they said. They believe that cases of COVID-19 here in Oregon will double every 6 days. The models say in about 3 weeks' time, the state may need 1,000 hospital beds and 400 intensive care unit beds to care for patients. The state projections say 20% of people who get the virus will need to go to the hospital and 10% of people will need to go to the ICU.
And as for the death rates, the projections say up to 9% of those older than 80 who get COVID-19 may die, though that number drops to below 1% for those 50 years or younger. And this does not take into account underlying health conditions that may make those numbers more grim.
Well, again, we point out the model the state used for those projections was without any social distancing measures that are now in place. They are hoping those will greatly help.